Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae. The disease itself has been known since ancient times and is mentioned in various ancient texts, including the Bible, ancient Chinese manuscripts, and Hindu texts. Thus, leprosy has been recognized and described for thousands of years. However, the causative agent of leprosy, Mycobacterium leprae, was first discovered by the Norwegian physician Gerhard Henrik Armauer Hansen in 1873. Dr. Hansen identified the bacterium through microscopic examination, making leprosy the first disease to have its causative agent identified, which is why it's sometimes referred to as Hansen's disease. The discovery of the bacterium was pivotal in shifting the understanding of leprosy from a purely spiritual or moral affliction to a medical condition with a known bacterial cause. Leprosy, Hansen's disease, is caused by the bacterium Mycobacterium leprae and, less commonly, Mycobacterium lepromatosis. The exact mechanism of transmission of leprosy is still not entirely understood, but there are several proposed routes of infection. Respiratory transmission. The most widely accepted route of transmission is through respiratory droplets. People with the lepromatous form of the disease, a more severe form, can shed the bacteria from their nose and mouth. When they cough or sneeze, they can release droplets into the air which, if inhaled by a susceptible person, could lead to infection. Direct contact. Prolonged, close contact with someone who has untreated leprosy over a long period can increase the risk of acquiring the disease. However, simply touching a person with leprosy won't transmit the disease. The skin lesions of a person with leprosy may contain the bacteria, and broken skin or mucous membranes, like in the nose, could potentially be entry points for the bacterium. Insects. While it's a less established route, some studies suggest that certain insects might play a role in the transmission of the bacterium, especially in some endemic areas. Leprosy is not highly contagious. Despite historical stigmas, leprosy is not easily transmitted. Many people have a natural immunity to it, and prolonged, close contact is often required for transmission. Early detection and treatment decrease transmission. Once a person with leprosy starts treatment, they quickly become non-contagious. Effective multi-drug therapy, MDT, has been available since the 1980s and can cure the disease, halting its transmission. Genetic factors. Some studies suggest that certain genetic factors might make some individuals more susceptible to the disease than others. Leprosy, Hansen's disease, is a chronic infectious disease primarily affecting the skin, peripheral nerves, mucosal surfaces of the upper respiratory tract, and the eyes. The symptoms can vary depending on the type and severity of the disease. Here are the common symptoms associated with leprosy. Skin lesions. These may appear as discolored patches on the skin, which can be lighter or darker than the surrounding skin. The lesions might be numb due to nerve damage, meaning there could be a loss of sensation in these patches. The lesions might not heal or take a very long time to heal. Nerve damage. This can lead to numbness and loss of temperature sensation, especially in the hands and feet. Muscle weakness, especially in the hands, can occur, leading to problems like clawed fingers. The loss of sensation can result in frequent untreated injuries and burns, which, combined with muscle weakness, can lead to physical deformities over time. Eye problems. Reduced blinking due to facial muscle involvement might lead to dryness in the eyes. Paralysis of the muscles around the eye can lead to blindness. Nasal congestion and nosebleeds. These can be symptoms due to involvement of the nasal mucosa. Swelling or lumps. These may appear on the earlobes and face in certain forms of leprosy. Painful or tender nerves. Swelling and tenderness can be seen in some patients. Loss of eyebrows and eyelashes. This can happen in some cases. Joint pain and muscle weakness. These can be additional symptoms in some patients. Ulcers on the soles of feet. Due to loss of sensation, ulcers might develop, especially in pressure points. The manifestation of symptoms and their progression depends on the individual's immune response to the bacteria. There are mainly two types of leprosy based on symptoms. Tuberculoid leprosy, a milder form with fewer lesions that are numb. Lepromatous leprosy, a more severe form with widespread skin bumps and rashes, numbness, and muscle weakness. In between these two types, There are borderline forms of leprosy, which show a spectrum of symptoms. Leprosy, also known as Hansen's disease, is a treatable condition, and its treatment has evolved significantly over the decades. The primary method of treating leprosy is with multi-drug therapy, MDT. MDT has been recommended by the World Health Organization, WHO, since 1981 and has proven to be very effective. The approach involves using a combination of drugs to prevent drug resistance and ensure comprehensive treatment. Here's an overview of how leprosy is treated. Multi-drug therapy, MDT. The MDT regimen is based on the type and severity of the disease. The two main classifications for treatment purposes are paucibacillary, PB, and multibacillary, MB, leprosy. Paucibacillary leprosy, PB. For PB leprosy, the typical MDT consists of dapsone, taken daily, rifampicin, taken once a month. This treatment usually lasts for 6 months. Multibacillary leprosy, MB. For MB leprosy, the MDT consists of dapsone, taken daily, rifampicin, taken once a month, clofazimine, taken daily and in an additional monthly dose. This treatment usually lasts for 12 months. Monitoring during treatment. Regular monitoring is crucial to ensure that the treatment is working, to track any side effects, and to assess nerve damage progression, if any. Managing complications and reactions. Some patients may experience reactions even while on treatment or after completing treatment. These reactions can manifest as inflammation in the skin and nerves. They can be painful and might cause further nerve damage. Type 1 reactions, reversal reactions, are treated with corticosteroids to reduce inflammation. Type 2 reactions, erythema nodosum leprosum or ENL, can be managed with corticosteroids and sometimes with thalidomide or other medications. Prevention of disabilities and rehabilitation. Due to nerve damage, patients with leprosy may develop disabilities. Care involves physiotherapy, custom shoes to prevent foot ulcers, and training to protect numb areas of the body. Surgical interventions can help restore function in some cases, like releasing contractures in fingers or repairing damage around the eyes. Education and counseling. Given the historical stigma associated with leprosy, counseling and education are essential to help patients understand their condition, adhere to treatment, and reintegrate into society. Vaccination. The BCG vaccine, primarily used against tuberculosis, offers some protection against leprosy and is sometimes used in endemic areas. The World Health Organization, WHO, provides MDT for free to all endemic countries, ensuring that all patients worldwide have access to treatment. Early detection and prompt treatment are crucial to curing the disease, preventing disabilities, and halting its transmission. If someone suspects they have leprosy or is showing potential symptoms, they should seek medical attention immediately.